All right, well, the Central Library is using 3D printers to make plastic parts needed to assemble those face shields for our healthcare workers. Here to talk more about the project is the CEO of the San Diego Public Library Foundation, Patrick Stewart. Patrick, good morning to you.
Good morning. Thanks for the invite.
Well, thanks for joining us and for what you're doing to help our healthcare workers. Let's talk a little bit about what exactly these 3D printers are doing.
Sure. Well, if you see behind me, we're here in the Innovation Lab on the third floor of the Central Library downtown, and we've got about 16 3D printers that have been working tirelessly each day to create the materials necessary to fabricate, as you said, the 3D or the face shields that are needed desperately by healthcare workers and emergency and frontline workers as we're trying to battle this coronavirus. And our goal here is to be able to print about 300 of these each week, deliver them to healthcare workers and frontline workers so that they stay safe and they're able to keep all of us safe.
So how many have you delivered? What's the total goal in the end? Do you know how long you're going to continue doing this?
Sure. Well, we have the capacity to print about 5,000 of these, and the printers have been going for a couple of weeks now. We've delivered a little over 400 so far, and there's going to be another batch that's delivered this week. We've made about 1,000. And in addition to the face shields, the team here has created these nifty gadgets here to help the healthcare workers who are using the cloth masks or the surgical masks to fit behind the head so they are not uncomfortable behind the ear and so that they're more comfortable as well. And we're hoping to deliver about 600 of those out into the community as well.
That's wonderful. How did this idea get started? I mean, have you been working with these 3D printers for a long time? How did this all come together?
Sure. Well, the 3D printing technology is a pretty important part of what's already encased in the library system already here at Central and then at several other branches. And a couple of weeks ago, one of our colleagues reached out to another colleague at Scripps and said, you know, we have this dormant technology since we've been closed down that we would be able to put to use for you. And they immediately responded, very excited about this opportunity, connected us with a gentleman from Francis Parker who had been working on a design for these. And then we brought that in here, and a very talented public technology services librarian, Catherine team. And we just got one thing going after another, made the connection with Scripps and Kaiser at the time. And through some funding partnerships that we had with SDG&E and the San Diego COVID-19 Community Response Fund at the San Diego Foundation, we were able to quickly get this going, ordered all the supplies, new printers, and get these things out in the community.
Now, you said a gentleman from Francis Parker. The high
Yes.
school? Are you talking about a high school gentleman being involved in this idea?
He is I believe is the chair of the science department there.
Okay,
so
okay.
He goes down as well, and so he put his technology brain to use to be able to figure out exactly how to get these things going with the 3D printer technology.
The innovation that is coming out of such a horrible situation is really wonderful to see, and it kind of works well because we know the library is shut down, but you're still providing services in addition to this. Can you talk about what's still open and available for the public to utilize while you're shut down?
Sure. This kind of technology is just one example of the essential services that the library provides, especially on the digital side. Since we've been closed down, we've seen a considerable uptick on ebooks, on the digital learning software, tutoring software, programs to help parents and kids make the transition from learning at school to learning at home, entertainment software, all that sort of stuff. All of this is available regularly through the library. But with the physical branches being closed, you know, they've been amplified. Their use has been amplified considerably. And we're seeing such an uptick in relationship and engagement building around the digital properties at the library.
Well, that's wonderful. Patrick, thank you so much. And it's just incredible to see the service you're providing to our healthcare workers. I know they're extremely grateful. So keep up the great work.
Thank you very much. We appreciate it.
Take care.